good description of the motivation for the academician and industry as far as product promotion related reasons, but perhaps interesting idea of confidence being a barrier for clinical engineers to publish. We would like to visit that subject in the question and answer segment at the end of the presentation. Once again, at the bottom of your screen, you have a tab with Q&A mark, and you're welcome to submit questions to the faculty. Before we jump into the other part of the world, I would like just to take a moment and tell you about Leandro's work. Leandro, my co-moderator today, is from Warwick University in the UK. And he has tremendous interest in how can we take the research and publication that Professor Clark and Professor Palikarakis talked about from the European view and bring it to low and middle income countries in other parts of the world. Specifically, Leandro is working with students and the application of clinical engineering in Benin, in Africa. And I enjoy to see some early publication coming from that country because of Leandro's encouragement to go ahead and take clinical engineering adaptation of technology from the West into low and income country markets, into hospitals in Africa. So I would like to give credit for Leandro for pushing that important transfer of knowledge to other parts of the world. And talking about other parts.
Yadin, we may need to do Ilir next because he's got a time limit.
Absolutely. And changing the order of the presentation because time limits, we will ask Ilir Kullolli to come and tell us as Director of Clinical Engineering in very active and famous medical center, Stanford, in California, in the US. What does he see as the barriers? What does he do to encourage his staff to get on with publication? And how does he manage and see the outcome of that? With that, Ilir, as president of ACCE, on top of everything else, please take the mic. Unmute.
Hey, thank you, Yadin. Just confirming that you can see my screen.
Yes.
Yes.
Perfect. Thank you. And thank you for making this time adjustment. I really need to drop off at 9 o'clock, so I wanted to make sure that I could share this information with everybody before I had to drop off. I heard the part of the previous presentation, and it seems like, you know, we have some really great speakers here. So thank you, Yadin and Tom and everybody else for putting this together. I want to address the you know, how we promote presenting and publishing, like what practically in my hospital, as well as with ACCE, and you know, certain ways that we can do this. So, in my organization, you know, as a leader in my organization here at the hospital, and as a leader in your organization, I'll suggest certain things that you can do in order to promote speaking in a conference or promoting, you know, publishing. One of the things that I do is work with my hospital leadership to increase the refund amounts for people to participate in either attending courses or attending conferences or other things that they may need, you know, such as books or subscriptions to different magazines, subscriptions to different journals, in order to increase their, you know, to increase their knowledge, to increase their participation in the profession. I also work with HR and finance, again, to ensure that certain clinical engineering and biomedical engineering conferences are covered events. But clinical engineering, biomedical engineering, HTM, whatever you want to call it, it's not one of those fields that is very well known by our partners in finance or in other areas in the hospital. So it's really important for me, as a leader, to be the face of clinical engineering and show them that, this is what we do and this is why it's important for us to attend these events in order, not only to advance the profession, but also how the hospital can benefit from my staff attending these events. Again, make sure that certain biomed courses are covered, and importantly, the certifications are covered. This is one of those things where, again, the hospital will gladly pay for certification in nursing, they'll pay for certifications in project management. However, they don't know much about clinical engineering in general, so and the certifications that come with it. So, one of the things I work with is to make sure that these certifications are things that are acknowledged by our leadership, but also that they pay for them, which is the important part, because many certifications are actually quite expensive, as well as, getting the books and getting courses covered for those certifications. And I also work with my leadership that, these certifications, these attendances, these things that my staff does come with an incentive, because, it's great for them to cover all these things, but, what is in it for the clinical engineers? What is in it for the technicians? So, either I work with our leadership in order for them to get promoted, in order for them to get a salary increase if needed, or give them additional responsibilities that come with these things. So that's part of what I do as a leader in my organization. And in my department, I try to be as transparent as possible. So I let my department know of everything that I've done in order to convince my leader, to convince the hospital leadership in order to, to cover these things. So that the department knows that, these things are not really a given. These things, we work hard for these things. We work hard for them to be able to get access to all these courses and conferences and journals. So, so that way they can appreciate it more. I provide incentives to attend conferences and to publish. So, I make sure that they can use all the funds that we have allocated for them to attend these events. But also, if someone is presenting at a conference, if someone is publishing and needs to go, has a poster somewhere, those expenses are completely fully covered, and they can attend another conference with the previously allocated funds. So that way, they can, they have a bigger incentive to present, a bigger incentive to go and show a poster somewhere, a bigger incentive to go and attend certain courses. So again, provide incentives to get certified. And I also like to acknowledge all the people who present, publish, or get certified. And I do this by, we have an organization newsletter, so every time somebody gets certified or publishes something, we make sure that that is cited in the newsletter. We have a department newsletter that we send out monthly, and we publish, in that newsletter, we put the whole, if it's a publishing, if it's a presentation, we put that on that newsletter, as well as we acknowledge those people. And in many cases, when somebody is presenting somewhere, we do an organization screensaver so that people in the organization are aware that this is going on, so certain people can attend those, those virtual events in most cases. As well as we put this in the homepage. We have a homepage, a website for the department, so we acknowledge everybody that presents or writes an article. We acknowledge them in the homepage of the department. And again, on the personal level, I promote presenting and publishing by using these people, the people that are presenting, the people that are writing something, by using them as subject matter experts and giving them more responsibilities. So let's say if somebody is presenting on mitigating, on decreasing the alarms in a nursing unit, and we have one of those projects happening in those floors, let's say some patient monitoring project, I like to, to promote that by giving these people more responsibilities and make them the subject matter expert and make them the project manager for that certain project. And again, as a leader in my department, I also like to act as a mentor, and if somebody wants to publish, somebody wants to present somewhere, I provide them a lot of guidance. I make sure that they are taking copious notes during a project. So with the idea in the back of their head that they will be presenting this somewhere. I show them different journals and magazines that they can publish. Certain journals and magazines are for, geared towards one thing, and certain other ones are more geared towards certain other things. So I just want to make sure that they have the right information and what, what journal, what magazine, what conference is more appropriate for what they're doing. And again, I start with something, I like to tell them to start with something they're comfortable with, especially, I remember myself, the first presentation I did was, we all had the butterflies probably when we did our first presentation. So I take that experience and I try to apply that to everybody and tell them that, try to publish or present in something you're comfortable with, so that, you don't, when you get the butterflies, you can get through them with ease. And also, I'd like to offer to present with them if needed. I know that a lot of people may not be super comfortable to present something by themselves. So if they need somebody to get them started, I'm there for them. I've done that for a few of my teams. I just like to be there, speak for 5 minutes about the organization, about what my team is doing, and then, give them the microphone and they can take it off from there. So if you want to publish, if you want to present, what do you do next? Let's say you're somebody that hasn't done this before, and I would recommend certain things. These are not, written in stone. I think a lot of people can do a lot more. But in your workplace, definitely talk to your boss. Don't blindside your boss. Don't blindside your manager. Make sure that they are aware of what's going on. They will help you if they are the right manager. I would say recruit them to be your mentor, or help you find a mentor. And recruit them to publish or present with you if needed. I would highly recommend to join a professional organization or society. There's a lot of them out there: ACCE, IFMBE, your own country's clinical engineering, HTM organization. Join them. There's a lot of information that's available there. Certain things that can help you with publishing, and certain things that can help you with presenting different conferences. So I highly recommend that. A lot of great information out there. It certainly helped me quite a bit. Participate in their meetings. If there are meetings that they put together, definitely participate. Again, you'll learn a lot. And I would highly recommend to volunteer in different committees for these organizations. And the reason for that is because once you volunteer, you can see a lot what happens within an organization. You can find out if it's the right organization for you or not. You can find out how things work. You can find out. You can actually get introduced to a lot of people. I remember when I first volunteered for ACCE, I was with the education committee, and man, I met, I don't know, like 20 people that had 20 subject matter experts, like in the first couple of months that I was there, because I was trying to recruit them to speak in different ACCE webinars, and I got to, spend hours with them on the phone and learned a lot from them. So definitely do that. It'll really help you in growing in your career. And again, share your knowledge in order to grow yourself and the community. And I say this because every time I publish, every time I write something and I present on something, I feel like that information is out there and I need to learn more. Otherwise, I don't have an edge on everybody else. So by doing that, not only am I sharing the information and helping the profession and grow, but I'm also trying to encourage myself to learn more. So again, and you can do this again by publishing, presentations, as well as sharing that information in the workplace. In my professional society, in ACCE, as a leader with ACCE, or in your professional society, I would highly, recommend be active. Presenting, publishing yourself, leading by example is the best way to promote publishing. It's the best way to promote presenting in conferences. If you are only saying that you should do this, you should do that, and people see that you don't do that, then sooner or later they'll catch up with it, and they'll find out that they don't really need to do this. So again, be an example. If you want people to publish, if you want people to present, you need to do that yourself, so you can lead by example. Encourage members to present, especially during the organization's sponsored events. With ACCE, we have a lot of symposiums. So I would highly recommend to encourage the members in your society to present in those symposiums. It's very important. It's hard for ACCE, IFMB, in many cases, to find speakers that are appropriate for certain things, for certain presentations, for certain publishing. So it's really important to encourage your members to do that, so that, next time when you need a speaker, when you need somebody to write an article, that, it won't be very hard. And again, make sure that you are thanking members who present or publish. You do that with the organization newsletter, different board and committee meetings. Take the time, whenever you can, to thank them. There are certain membership events that you can put together it's really important to, especially because this is volunteer work that a lot of people are doing. And, you know, as the previous presenter was saying, it's a lot of time that goes into putting together to publish something. It's a lot of time to present something. It's a lot of time to attend different meetings. It's a lot of, you know, it's a lot of time that really doesn't come out of your workday, but comes out of your personal time. You know, you probably not spending time with your family as much, just in order to attend, you know, in order to attend a conference or in order to publish something. So make sure that you are thanking all the members that are doing that, because it's, you know, it's very important that they do that again. Then this is it. That's my presentation. Thank you. I think I was planning to take 10 minutes, and I think it went a little bit more than that.
Following on your own advice, Ilir, I thank you and recognize the time you put towards this presentation. Excellent point of view from inside the trenches. How do you work with staff and help them to publish? I understand you need to go to attend other work-related tasks, so please free to do that. We will continue with the program, and again, we appreciate very much your point of view and presentation.